Leila Molana-Allen standing by in Beirut. Leila, what do we know about this closure exactly?
So the announcement has just happened. This had been discussed for a few days, but so far we haven't had a full statement on what exactly this will mean. We've heard lockdown, we've heard shutdown. What's confirmed is it will be from tomorrow evening until Monday morning, and there has already been a curfew in place from 7 p.m. every night. Now, that had been relaxed to 9 p.m. last week, but because of this uptick, it's gone back to 7 p.m. So from 7 p.m. tomorrow evening, some sort of full shutdown is going to happen. Now, different members of government have been saying different things. The health minister has said it will be similar to previous lockdowns we've had here, when only pharmacies and supermarkets open and there's that evening curfew. Then the interior minister said there'll be some exceptions, but it's not clear yet what those exceptions will be. And then another representative from the health ministry said that it's going to be much harsher than previous lockdowns because of their concerns, and only members of medical facilities will be allowed out on the street. Now, what's likely is that what's happening right now is some wrangling within the government over what businesses are going to have to close, what's going to be allowed to be open, because, of course, it's a very political issue here. Who's allowed to go outside, which businesses are allowed to open. And it's Ramadan, so people need to be able to get food late in the evening because they have to wait until sundown to be able to eat. So shutting places that you can eat earlier in the day is very controversial. We're still waiting for full details, but of course we will update you as soon as we get them.
Leila, things were going well in Lebanon. What happened?
They were going well. Lebanon's been listed as one of the 15 countries that has been really successful in flattening the curve. They've managed to keep the numbers very low. And this is why, from last week, the country started opening up again. One of the reasons they were successful is almost as soon as the first case came in, the schools were immediately shut. They started working on trying to shut the airport, and they shut down restaurants, bars, cafes, all sorts of places where coronavirus was known to spread. And so they really did manage to keep those numbers down. Until last week, it was down to under 5 new cases every day, some cases with none at all. And that's when they started to open up. From last week, some businesses were allowed to open, restaurants were allowed to open just until 7 p.m. and then this week until 9 p.m. And there were going to be more new openings next week. Things like hair salons and other businesses, people were allowed to start going again. But almost immediately we saw an uptick in cases. And it wasn't just because people were allowed to go to shops and restaurants like this again. It's also because they started bringing in repatriation flights from abroad, bringing Lebanese citizens who were stranded in other countries back to Lebanon. Now, all those people were tested as they got off, and many of those cases, many of the new cases in the country came off those planes. But while they have been self-isolating, there hasn't been mandatory government-controlled quarantine. So a combination of people being allowed to go out and socialize again, and new cases coming into the country from Lebanese expats. Now, the head of the Rafik Hariri Government Hospital, which has been operating the COVID response out of Beirut, has said that the problem here is a combination of, I mentioned, those factors, and also the fact that what they should have been doing was mass testing across the country, but they don't have the facility. They've only managed to start doing that in the last couple of weeks, and they don't have the facility technologically to track cases like they have been doing in other countries, in Asia, for instance, which means that they just are not able to keep quite as much of an eye on people who are maybe spreading as has been necessary. It seems the hope is during lockdown they are going to massively expand the amount of testing they're doing, particularly of people like public service workers and supermarkets, etc., to see if they can pin down where the virus exactly is.
Leila, thank you very much for that update. Leila Molana-Allen reporting there from Beirut.